We are discussing about pelvic and obstetric scans in outside pregnancy, in pregnancy, around pregnancy, and just for the female body. I had introduced myself. My name is Dr. Jemima Kariuki. I am a gynecologist. I'm an obstetrician. I have been trained in Kenyatta National Hospital and the University of Nairobi. I help women every single day through the Wills for Life community. And these questions are stemming from the Wills for Life. So if you have any other questions you need to ask here, please just come to the comment section, ask, and we shall be able to reply to you. The second thing is that if you're new to us, please subscribe, hit the subscribe button, and we'll get on with the show. So we have about 30 minutes with you. We'll just ask your questions, answer them, and hopefully we'll leave here having guided you so that you understand when you go to your doctor what obstetric scans are all about, or what a pelvic scan is all about. So starting, basically what scans do is that they help us see what is within our bodies. And one of the doctors said it helps us see through the darkness within us. So a pelvic and obstetric scan is actually a very important thing. One, it is a highly informative scan. I'll start with the obstetric ones because they are used to assess the pelvis, assess the baby, assess the uterus, assess the ovaries. All right. And especially during the developments in pregnancy. They also give us a detailed imagery of what's going on inside the body. And I'll show you in a few minutes so that you kind of understand what we mean. When you look at them, they look like they're black and white, but we do promise there's actually a lot that as doctors we see. And they really do help when it comes to understanding the human body, right? The other thing that we use the scans for is for anomalies detections or scan anomalies, especially the 20-week scan. We also have an NT scan at 11 weeks. So those are used to just check through to see if you have any issues that we should be checking on the baby. And if you've looked around, you'll see that we've also been having procedures that are happening in utero, which means that while the baby is still in the fetus, we can actually do surgery for them or give them blood transfusion. And what helps us decide that is the scans that we do. So, of course, it really helps us as obstetricians. It gives us a lot of guidance for us to know just what to expect or how to treat you better in obstetrics. And of course, we'll get to the gynecology bit where you're not pregnant. They're still a really essential tool for us to actually treat you. So the other thing that you see here is the evolution. I'll just take you through it. One, they were developed in 1950s. A question that we hear often is a scan safe? And I guess that's why we are seeing how many scans should one have and all that. They use waves. A scan was actually developed from sonar radars. When we had the World War, they developed sonic sounds, and these sounds could be used to check the distance between water and maybe the submarine. It's also the same mechanism that a whale in the sea uses. It checks how far the next object is from its body using those sonar waves. So it is very essential for us to actually have a fluid in between the probe that I'll show you and the body part that we are checking. So that's why you're asked to have a full bladder, unless it's a different type of scan, such as a transvaginal scan, where we use the body fluid as the imagery to see what is there. So it is a very, very safe tool because it uses sound. It doesn't use magnetic rays. It doesn't use, it actually X-rays, it actually uses sound. So because it is sound, it is very, very safe in pregnancy and outside of pregnancy. So to answer the questions I'm saying here, how many scans should one have? You can have as many as weekly if you desire, especially if you're having in vitro fertilization or IVF, but we will get to that in a bit. So now we have them in 3D, 4D, where they can actually paint out what's going on in your body or in the baby's body. And a 3D, 4D image can kind of print out or map out using the different angles that they're seeing to depict how the baby will look like, and they're actually very accurate if you look at them. So a 3D 4D scanner is an amazing tool of advancement in medicine. We also can check the baby's heart, and if the baby's heart has an issue, we can actually see how bad the issue is before delivery and guide the mom and the dad accordingly. So we need to actually have accurate scans in the body so that we can understand how to treat your baby and you better. So that's very key for you to understand that it's for us to treat you better. Before, pregnancies could go the entire mile without having any scans, but since we've had more scans done, we have really reduced the rate of deformities that deformed babies that are there, and we also really reduce the risk of anomalies. Like I've told you, some surgeries are conducted within the pregnancy to help the mother and the baby. So you can see how much this tool has helped us. So how do I prepare? Oh, sorry for that. I'll take you through how they look like, then I'll finish with how you prepare. So this is a typical image of a scan. You can see, oh, sorry about that. So you can see this mom is pregnant, quite pregnant. You can see the baby is quite big. It looks like about a 20 or 30 week pregnancy, 28 or 30 week pregnancy. But the white thing that is there is what we call a probe. So that is actually the ultrasound machine. The what we see on the left side is the monitor, but what picks up the sound waves is this machine, the white thing right there. So that's one type of a probe. This is called a transabdominal scan, and it's what most of you are used to. This particular scan, especially in the earlier weeks, requires a lot of fluid, about 2 to 3 liters, such that your bladder is almost full, that we can do the scan. Again, because it gives us a better optical angle to see the view behind it. Yeah. This is the other scan that you do. It's called a transvaginal scan. And before I continue, there are very many other types of scan, including an echo ECG, but an echo for the heart, Dopplers for the blood vessels. But what we're looking at here is just what is useful in obstetrics and gynecology. So we have a TVS scan. It looks like that. And you can see just how well it's able to look at the uterus, and it's able to look at the surrounding features. But as you can see, it's quite exposing because you have to lie down and you have this probe entering you. The probe is small, it's smaller, it's actually the size of a finger, but it can feel daunting to have something inside you, but it's not painful. And if you relax, it's also not uncomfortable. So I'll take you through the features that we see in the first trimester. In the first trimester, we do a scan at about, usually we start them at about 7-8 weeks, but the scan on my right side is a 5-week scan. It only shows a fetal pool or a gestational, it actually just shows a fetal spool. And then the black around it is called a gestational sac. Yeah. And then behind it, the same thing, a fetal pool and a gestational sac. So this particular scan is showing a baby right before the heart starts beating or before you see the baby themselves. Sorry, not a fetal pool, it's called a yolk sac. So it's before the baby is actually visible. So when you see such kind of a scan, it's not that you're having a type of miscarriage. No, this is not what we call a missed miscarriage yet. We have to wait and see how well the baby develops. On the left side now, we can see the gestational sac, which is a black thing. I wish I had a pointer. Let me see if I have a pointer. No. Yeah, so the black thing you're seeing there is a gestational sac, and then the white in the middle and the two small white dots in the middle, you have one called the yolk sac, such as the one on your right, and then you have this cloudy white thing that is small. That's the baby. So at this time, you're supposed to actually hear a heartbeat. And by the 6-week mark, that is something that you should be anticipating. So most women will delay till the 7th, 8th week mark so that they just do one scan instead of doing one at 5 weeks and then being told to come back after 2 or 3 weeks to see if there's an actual heartbeat. Okay, so at this stage, on the left side, there should be a heartbeat. Then this is the scan that all of us know. It's called the fetal anomaly scan. The fetal anomaly scan checks how the baby has developed. Starting from the middle, you're seeing the head, you're seeing the nose, the mouth, the hand over there. On the left-hand side, you can see a hand. On the corner there, you can see the cervix, the placenta. Down there, you're seeing the cervix again, all the way till the extent of the vagina. Then this baby really said hi during this scan. That's another hi up there. And then you can see the ribs of the baby, the stomach on that corner. So that just shows you a fetal anomaly scan. Now, in pregnancy, because those are the two that are most important, in pregnancy, you do 3 scans. These 3 scans are the first trimester scan, and it's especially keen to check on this bone. It's called the knuckle translucency, the nasal bone. So when you look at this bone and it's slightly white, we call that knuckle translucency, which is a good thing. It means that the baby has developed well. Then we jump to the 18 to 22 week mark, and a scan is done there. That's a fetal anomaly scan. It checks this thing that I've told you there. Has the head developed well, the heart, the chest. It especially looks at the spine, and if the spine is well developed, the limbs, all that. It is at this point, if we pick an issue, we discuss with the mom and the dad and see if they're willing to work with us to either keep the pregnancy and we'll guide them on what to do when the pregnancy has an issue, or if it requires surgery, or if there's nothing we can do, then we prepare them for that so that they can make their choice. Now, that said, I'll take you through gynecology scans. Now, everyone has gone to their gyna at one point or another, or rather, I'm hoping so, that you've at some point or another gone to your gyna and they've done a scan because you had pains here and there and you didn't know what was there, and you wanted to find out that there's nothing wrong with your uterus. So when you do that, we do a couple of things as your doctors. We'll do a physical examination. First, we'll listen to your history. Then we'll do a physical examination. That means we'll look at your tummy, we'll look at your breast, we'll look at your thighs, but most especially the tummy area, and look around the pelvic area. Is there a problem? Then now we do a scan. And then combining the history, the physical examination, and the scan, we're able to decide how to treat you better. Okay? So when we do a scan, if you're not pregnant, we prefer doing a pelvic scan, the transvaginal scan. So we prefer this kind of a scan. Just pick it out for you. This kind of a scan. And the reason is because it actually has better clarity. And one of the images that has been produced is something like this. You can see this thick substance is actually the uterus. And I can see the lining in between, and I can tell this uterus is ovulating because there are 3 lines in that center place. So you see that the amount of information that I'm able to gather. This uterus also has a bit of adenomyosis. So a scan can really, really guide you into knowing what to look out for. A question I was asked in the group was PCOS, and PCOS scans look like this. When you see such a scan, it doesn't mean that you have PCOS. No. For you to be told that you have the syndrome, you need to reach a particular criteria from the clinical diagnosis, your lab test, and then you'd have such a uterus. So most women come with 2 or 3 cysts. This ball-like, black-like things are actually cysts. These cysts are small follicles that did not grow to release their eggs. That's just what PCOS means. And this egg, this ovary, which is what looks like a big egg, this ovary then pushes them out to the side. So they're actually at the corners or the peripheries of the ovary. So that's what PCOS means. But you need the other three criteria. You can have such kind of an ovary and be absolutely normal, or you can have a normal looking ovary but have the other two criteria okay, and we'd still call you a PCOS patient. So just to have that out there, this is also another feature of PCOS, and I just brought this up to show you exactly what we mean. So you can see how small those two tiny follicles are. So if you see this, please don't be concerned. This is what we mean. Ask your doctor, talk to them nicely, and have them explain to you what exactly is there. This kind of a cyst, small like this, about 0.2 or 2.4, does not require surgery. Kindly, kindly, kindly. Having cysts in your ovary does not mean surgery. In fact, in the first trimester, other than having the uterus, there's always a cyst on the right or left side of a pregnancy, and that's a corpus luteal cyst. It is a cyst that produces the hormones until the placenta is well developed. So it doesn't mean that if you have that kind of a cyst, you need surgery. No. And if you do surgery on such a cyst, you actually end up losing that pregnancy if it's not beyond 10 weeks. Some of them are really big. For example, in the case of hyperstimulation syndrome, where you took medications to kind of help you with fertility, or you just overreacting to the hormones in your body, or you have other issues such as a hydatid form mole. So other than those scenarios where we really need to get out such type of a cyst or just put you on bed rest until the cyst subsides, honestly, in pregnancy, we do not touch cysts. Okay? And I say that with a disclaimer that some types of cysts that we will be observing, and if at 10, 14 weeks you still have such kind of cysts, you have a lot of pain, we do some tests and we find that they're different. It's a different cyst, not the one that is there in pregnancy, and it is growing with the pregnancy. Then in some cases, we actually remove the cyst and leave the pregnancy as it is. But those are very, very special occasions. And the times that we do, we actually write papers about it. And that is a high risk pregnancy. So a cyst usually is normal. So anyway, I just went in depth because I was asked about cysts. Let's go to this particular slide about how do I prepare. Sorry for that mismatch. If you're going for a scan, one, it is not painful. So you don't need painkillers so that you go do a scan. No, it's not painful at all. What you do need to do is drink a lot of water before your appointment. So if your appointment is at 2 and your scan is scheduled for 2, by 1:45 have your bladder almost full, because you may be told your scan is at 2. If you go with an empty bladder, you may have to wait another 1 hour to fill that bladder. And again, it's because of we need that acoustic so that we can be able to see this. Let me just show you in one that has this black that you're seeing here around the baby. That's a bladder, and we need the bladder to be full so that it gives us that black so that we have contrast to see the white, which is the baby. So we need a full bladder. If you're going for a transvaginal scan, please just still have a full bladder in case they want to first see something with a full bladder, then you omit or you pee, then they do the transvaginal scan. So it's still important to have a full bladder. Let the doctor check. If they decide they want to clear urine, then clear, and then you'll do your scan there. Yeah. So it doesn't require fasting, it doesn't require sedation, it doesn't require painkillers, it's a simple test. There's some types of scan where we push water so that it gives us the features of your uterus. For example, if there's a fibroid inside the uterus, along this lining, along this whitish or grayish lining, then we may require you to actually lie down for a lot longer, maybe like 30 minutes to an hour, as we push water, and as the saline is moving or the fluid is moving, it will show us where the defect is. But other than that case where we're looking at such type of scan, it usually takes about 10 to 30 minutes. 30 minutes for the fetal anomaly scan, because we need to listen to the heartbeat and look at the movements of the baby for a good 30 minutes. Some sonographers will take shortcuts and make it shorter because I think the baby is really active. But whenever the baby is not playing so well, you will see they will extend that scan for the proper 30 minutes as it should be done, and observe how the scan is, how the baby is presenting. If it's a gynecological scan, it may take 10 to 20 minutes, depending on what is being looked for. If it's something that's looking for endometriosis, adenomyosis, it will take more minutes, for example, even an hour, and it needs skilled hands. The other thing I will tell you about scans is that they really, really depend on who's doing them. So if your doctor is not very well it's subjective. If your doctor is not keen to look for something, they may not find it. Yeah, but that doesn't mean the doctor is bad. It just means that the eye did not catch it. So that's why sometimes when you see something, it's okay to seek a second opinion and just see if that's okay. Or if you're going for a gynecological visit, some gynas actually have a scan in the office. It's better to go to that particular type of doctor to see the scan and get the care you need. And if they need further clarification, they will send you to a radiologist. Okay. I will touch on a hot topic, which is miscarriages. There are types of miscarriages that we will see, such as this one on the right. Assuming this is at 9 weeks or 8 weeks, and we see this, if you see the brown, the one in the middle, if you see such a thing at 10 weeks or 8 weeks and there's no heartbeat, then we'll call that a missed miscarriage. Before we make a final decision, we will ask you to stay a week and repeat the scan. Within a week, we're supposed to see a baby who's developed, and that baby who's developed is supposed to have a heartbeat. So in such a case, we will send you to back home, then repeat a visit in 1 week. The other thing that you will notice in such a scan is that we may ask you to go to a different facility. You come the second time and it's still showing you the same thing. We may ask you to go to a different facility and repeat the scan, just so that we can confirm that for sure 2 scans done 2 separate times in 2 different places are showing that there's no heartbeat. Then we can advise for a termination of that type of pregnancy, because it is already a miscarriage. Okay. And then some things that we also pick out in scans is at this level, we can actually find that there's a bleed in the uterus, and then you will be told it's something we call a subchorionic bleed, and we will ask you to take time before you progress with we'll ask you to take time off pelvic duties. So no bending, no sex. We'll give you progesterone to help relax the uterus so that the clot does not dislodge and actually come out with the baby. So I hope all of you have learned a thing or two. I've really tried to remain within time. If you have any questions, please feel free to ask. I am here to respond to all of them. And while I'm here, kindly just subscribe if you haven't subscribed. The button should be right there down. Please subscribe. It will help this channel grow in a mighty, mighty way. So, yeah. Here we have Nkirote Joy asking, hi Joy, asking how many scans should one have? Okay, Joy, it depends. If you're asking in pregnancy, then in pregnancy you need, thank you, Lillian. In pregnancy, you need 3 scans. Yeah, ideally. First trimester scan, it is very important for dating. Dating will mean that it gives us the correct EDD. And estimated due date, sorry. And that is because at that particular gestation, all babies are almost the same size. So if that baby is measured under 6 plus 2, we count exactly 40 weeks, and that becomes your due date. So that's called a dating scan. And it also tells us if the fetus is viable, which is what we mean when we check for miscarriage or no miscarriage and what have you. The second scan is a fetal anomaly scan. And a fetal anomaly scan just checks for if the baby is well developed, if there are any issues that we are looking for. In the third trimester, we look at is the placenta giving the baby sufficient food? It's done around 34 to 36 weeks. Is the placenta giving the baby sufficient food? Is the baby growing well? Does the head and the tummy and the bones align? Are they growing at the same rate? And if we note a delay, then we may ask you for a repeat scan, and if there's further delay, we may deliver the baby sooner. Okay, so the third trimester scan. That said, there are people who we do repeated scans for. If you have any history of pregnancy loss, we will be very adamant about doing a couple more scans to rule out any issues. If you had prior history of hypertension in pregnancy, diabetes in pregnancy, if you had any issues of fetal hydrops, or a baby with a knuckle cord issue, for example, spina bifida, or all those complications that we'll pick out from your history, then they may require more scans. That said, that areas you go or doctors you go to and they have an in-office scan, and they may scan you in every visit, and that is totally okay. You get to see how the baby is developing at every juncture, and issues are picked up earlier. Yeah, usually they don't charge beyond their usual consultation fee, because it also helps them to see how the baby is developing generally. So if you have such a gynecologist, well and good, you're really, really blessed. The other thing is, if you have twin gestations, we do serial scan. Twin gestations, I mean you're carrying twins, you're carrying triplets, or you're carrying an IVF pregnancy. Those kind of pregnancies, we do scans every 2 weeks or 10 days based on how the baby is growing, especially if they are identical twins and they're getting issues around the 30-week mark. Okay, so that's just important for you to know. Outside of pregnancy, you need a scan at least once a year, just to make sure that everything is developing well as you're doing your usual well woman checkup. So it's important. They'll check how the ovary is doing, they'll check how the uterus is doing, they'll check for any fibroids, they'll check for any cysts, they'll check. All these things are used to check if the body is growing well. If you have a coil is checked at 2 months after it has been put, at 6 months after it has been put, and once every year. So that's also quite important to let you know, because the coil can move. So that's how many scans are recommended. Hi, Deborah. Thank you for your question. I think I've already answered how many scans are recommended while pregnant. 3 minimum, but if you really, really don't have money and you want to do just one scan, do that scan at 20 weeks. Okay? If you have no other option, do that scan at 20 weeks. All right? Yeah. Then I can see here Lillian is saying she's subscribed. Thank you, Lillian. Be blessed. Anyone else who's on the live, please follow Lillian's example and subscribe, and you will be blessed. We thank you. Thank you for your time with us. I think I have about 7 minutes to close. I will just tell you, scans are important. I hope you've seen the importance of them. If you have any questions, I still have a minute or two I can answer, but be blessed. If you're not on the Wills for Life group, let me just post here. Our number is 0719116611. Thank you, Fiochi. Yeah, so our number is 116611. Please feel free to DM. That's in Kenya, so +254. Sorry, for others outside. So just DM or WhatsApp +254 0719 116611, and we'll definitely connect with you. If you want to be a member of the Wheels for Life community, Karibu Karibu. It's 150 shillings a month or $1 a month. But if you're unable to and you still want to be with us, please don't fret, don't be scared. We are really blessed because some moms are able to pay for other moms or are willing to. And we're really looking for people who can advertise or can support other moms. So if you're one of those, please also feel free to join us because we want no woman to walk alone in pregnancy. All right. Thank you. Who is this? Belinda, thank you so much. And God bless you as well. I'm really blessed to have all of you as well. So thank you, thank you, thank you. Be blessed and have a good evening. Mwah.